Here we go. Hey, everybody. My name is Jayme. I'm the co-founder and executive director of Faraway Friends, and I am here with Kathleen May, who is our community health initiative advocate at Faraway Friends. So Kathleen, I was super excited to have you just jump on a quick Zoom with me today so that we could share with our donors more about why Raise to Reopen is so important from a public health perspective. I think everything that's gone on this year, it's really important that we touch on why a safe reopening to schools is something that we're investing in right now. So if you wouldn't mind, I would love for you to introduce yourself and talk about how you got involved with Faraway Friends.
Definitely. Very happy to be here. I originally found out about Faraway Friends when I was in high school at Lakewood High School, and I heard Jayme speak and was very inspired. And I ended up going to the University of Iowa to pursue public health, and I graduated this past May in and I got my bachelor's of science in public health, a minor in global health studies, and a certificate in nonprofit management. During my time in college, I received the opportunity to travel to Uganda with Faraway Friends, and it was obviously life-changing. Not only did I make lifelong friends in this beautiful community of Namasale, I also learned things that I definitely couldn't have learned in a classroom. I got to talk with students and their families and teachers, visit with community leaders, interview the health center 2 nurses and other medical personnel in an urban hospital. And it was there when I started thinking about how education and health and community development all feed into one another. And so taking my experience in Uganda back to the US, I ended up applying to grad school at the University of Iowa. And I am currently in my final year of pursuing my master's in public health, specifically in community and behavioral health. And I'm very excited about that. And over these years, I've discovered a lot of passions for like health equity, mental health, reproductive justice, global health, rural health, and how community and cross-cultural partnerships, systems thinking, and continuous learning can be so powerful. And all of that began in Namasale. So now I serve as the Community Health Initiative advocate for Faraway Friends. And I care so deeply about their mission and the folks they serve in Namasale because I really believe that everyone has a right to health and quality education.
Beautiful. And that's why I wanted to talk to you today, Kathleen, is because you have a really interesting perspective in that, you were a young person who got involved and got excited about the work that we were doing in Uganda, got to go there, meet local leaders, spend time with Collins and the Omia family, learn about the needs of this community. And then you took that learning home, applied it to your studies, and now you can be, from a donor perspective, from an American perspective, an advocate for the communities we partner with. So that's super exciting. In this Raise to Reopen campaign, as you know, we're working to specifically bring back our 250 kids who have been out of school for like over 8 months due to COVID. We're investing in a lot of work that's meant to make our schools safer. So I was hoping you could talk to our donors about how returning to school, a safe return back to school, specifically for our boarding school section, has a positive effect on the lives of our students. What does that look like for kids out there?
Yeah, this year has obviously been tough for everyone. It's been tough on students everywhere, and returning to school is important for everyone. However, different areas have different capacities to serve their students through distance learning. And so this pandemic has definitely been exacerbating disparities that are already currently existing in health and education, especially those in low income and rural communities. And the long-term effects of this loss in learning can have detrimental impacts on the individual child with physical or cognitive development, women and girls, and overall community development. Obviously, schools provide learning opportunities and social interaction, but some of the things that people might not necessarily think about, especially in rural communities like Namasale, is that boarding schools provide a safe space to learn and grow. Um, Students who might not have regular meals at home do get regular and safely prepared meals at GLP. Um, Parents can go to work if their children are in school, which helps with financial stability, access to wash, or water, sanitation, hygiene facilities is provided at GLP, which is extremely important in preventing infectious illnesses like COVID-19 and diarrheal diseases. Um, Diarrheal diseases is responsible for many, many deaths in children, and having access to clean drinking water and safe food preparation, hand washing, and toilet facilities are all key methods that schools can specifically provide children. And again, it's especially important now with COVID-19 to keep students and their communities safe. And another really important thing that I want to point out is that it's also really important for girls to continue their education, because as more girls are educated, community development occurs. Maternal and child deaths decrease, generational poverty can be overcome, and with like education and family planning, the rate of population growth decreases and ends up having even a positive impact on climate change, which is another major issue. So many girls who can't go to school may get married or pregnant early, and they usually never return to school. And then risks of violence against women and girls also increase when they're not in school. So it's really important for our girls to come back to school. Education and health go hand in hand. So by supporting the students' return to school, you're impacting their health, short-term and long-term, as well as their professional future and the communities that they live in.
Oh, so beautifully said. It's a full circle approach, right? Right, Kathleen. It's like,
Absolutely.
getting kids back into school. It's not just about they're missing school, they need to be back in the classroom, they're missing these lessons. It's really a full circle puzzle piece in this puzzle of international development, in this puzzle of ending cycles of generational poverty. So
Yes.
one of the things that we're funding through Raise to Reopen is we're trying to raise $6,000 to start a mini school clinic and just outfit our school with some basic needs that it would need to serve our kids in their health needs, and also hire a nurse for a full year. This is something that we haven't always had at GLP. When our kids get sick, we have to take them to the local health center, but having a nurse on staff is a total game changer. So would you talk about some of the benefits about having a nurse on site?
Definitely. There can be a lot of benefits. I firmly believe that access is key. Having a nurse on site increases access to care for students. Um, a nurse can monitor health practices and behaviors, prevent and treat certain diseases and injuries, and also link students to further health resources if it's not within the nurse's capacity to serve them. Specifically, they can help teach the importance of healthy behaviors like hand washing, which is super important right now. They can have a positive impact on mental health because they are providing that additional support that students need in their development. They can even play a role in keeping students in school. And as you mentioned, like on the more logistical side, students and teachers would not have to travel so far to receive care, which is another barrier for a lot of people in rural areas. And then finally, the health system is already overburdened, especially with COVID-19. So having someone with the necessary skills and knowledge on site can help lift that burden from local clinics and hospitals.
Beautiful. So hopefully today on Giving Tuesday, we're able to fund that nurse's salary and fund our
Absolutely.
clinic. Another thing that we're doing is rebuilding our toilets at GLP. We have had, of course, student toilets on site, but they weren't what is called dry box. So we just had regular pit latrines. I've had some donors ask me, well, you guys already have toilets, so what's the point in rebuilding them or building new ones to make them better? Like, I don't understand the difference. Would you be able to touch on like the difference between dry box latrines versus regular pit latrines and how that makes a difference in a student's health?
Yes, definitely. So dry box latrines are drainable and last longer, so maintenance may not be needed as often, and the draining of latrines will not have to occur as often as well. And with better sanitation facilities, drainage will occur more appropriately, which is critical because through it's to ensure groundwater and soil is not contaminated. So having a better system in place will protect the children and teachers and staff at GLP. And it's really important to continue increasing and improving access to more sanitary facilities. To provide like a little bit of background, 51% of Ugandans don't have access to safe water. 82% don't have access to adequate sanitation, and this is from the WHO and UNICEF, their joint monitoring program, the report that they released in 2017.
That's like recently. You're telling me that like
Recently,
51, what was that stat again? 51%?
51% don't have access to safe water, and 82% don't have access to safe, adequate sanitation. So it's um and they even found that 6.41% of total deaths were due to diarrheal disease, and a lot of diarrheal diseases are because of unsafe water and poor sanitation and inadequate hygiene. And so again, this has a negative impact on growth and development of the individual student and their communities. And now with COVID, it's even more important to ensure that students and teachers and staff have access to improved and appropriate sanitation facilities. Um, and again, to touch on the previous theme of how this is really important for girls, latrines and improved sanitation facilities are really important for girls who are menstruating because they can continue to go to school and not worry about managing their hygiene needs. In communities with limited access to toilets and sanitary products, it can be really discouraging for girls, especially with stigma. So this might push them to not attend school while they're menstruating or just not go back to school. And so providing a safe and sanitary space for girls is really important in continuing their education.
So rebuilding these toilets, again, one of those high level priority needs that we have at GLP right now. It costs about $6,500 to $7,000 to rebuild our toilets. So that's one of the needs that we're funding through this 20K Day for Giving Tuesday. Something else that I was hoping we could touch on was the issue of bat proofing our school. One of part of the Raise to Reopen campaign is bat proofing. We have an issue with bats getting into our buildings, teachers' housing, our dorms, our school, because it's been vacant for so long. And when these bats collect in the rafters, they're leaving their droppings everywhere, they're making homes in the walls. It's really, really important from a public health issue, I understand, to make sure that we're bat proofing our entire campus. Would you talk about why that is important from that public health standpoint?
Yes. As many might know, some diseases are transferred from animals to humans. They're called zoonotic diseases. And so it's important for people to remain separated from certain animals to reduce the risk of exposure. Bats can serve as reservoirs for infectious diseases, and reservoirs basically hold infectious agents, but these bats might not show any signs of illness, and so people don't know that that they're sick, and so this can lead to outbreaks and disease transmission, including previous outbreaks like of coronaviruses like severe acute respiratory syndrome or SARS, the Ebola virus, and rabies. And so it's common that bats roost in buildings, which again increases the risk of exposure to a virus through their waste. And so bat proofing can prevent bats from roosting in these buildings. And so again, as the health system is already the health system is already overburdened. So preventing infectious illnesses that can cause large outbreaks is really important.
So it's really a prevention issue.
Yes,
It's
prevention is key.
prevention is key. I've heard you say that to me before, and that's so important in the work we're doing right now. So as our public health initiative, community health initiative advocate, Kathleen, like you've seen firsthand some of the challenges that families in Namasale face with accessing healthcare. I know there's going to be some donors out there who are really passionate about this. Maybe they're nurses, maybe they've worked in a hospital, or they're studying the same thing as you. If somebody wanted to get involved and let's say they want to fund something specifically at Biko Health Center, or they have more questions for you, how can they get involved?
Yeah, if donors want to get involved in supporting community health focused initiatives with faraway friends, they can launch a fundraiser or sponsor a project such as a well or providing solar power at the local health center too that serves 20,000 people. I firmly believe in building upon the strengths and current infrastructure of the community, as well as enabling continuous partnerships and learning and sustainability to, I believe that's the path to improving community health. And so these projects would have incredible long-term impacts. And so if you're interested, there's more information about sponsoring these impacts on our website, farawayfriends.org. And I'm also always willing to chat with anyone about this. I could talk for too long about all these things. And so feel free to email me. I will definitely be there to talk.
Awesome. Well, thank you so much, Kathleen, for sitting with me today and helping myself and our donors learn more about why it's so important from a public health perspective and raising this $20,000 to reopen GLP safely. So thank you so much. And thank you guys for watching and being part of our live stream and our Giving Tuesday 20K day initiative. If you would like to learn more, you can visit our website at farawayfriends.org. Thanks.
Bye.